If you're in nursing school, then the state board exam is right around the corner, or maybe you just need to review some topics for an exam. Either way, we're here to help you pass. Welcome to the Nurse Navigator Network. Like, subscribe for new videos weekly. Jumping right in, osmosis. Osmosis is the movement of water across a semi-permeable membrane from an area of lower solute concentration to an area of higher solute concentration until the concentrations are equal on both sides. So key points to remember here are the semi-permeable membrane. It's a barrier like a cell membrane that allows water to pass through, but not larger solute particles like salt or sugar. The goal of osmosis is balance. The water moves to dilute the higher concentration of solutes. No energy here is needed, so it doesn't require ATP. Osmosis is a passive process, so no use of cellular energy there. So, simple example is if you put red blood cells in pure water, a hypotonic solution, water rushes into the cells by osmosis because the inside of the cell has more solutes than pure water. The cells can swell and burst. If you put cells in a salty solution, hypertonic, water moves out of the cells to dilute the salty fluid and the cells shrink, crenation. Why it matters in nursing. When it comes to IV fluids, nurses must choose fluids wisely. For example, giving pure water IV can cause dangerous cell swelling. Edema. Too much fluid shifts into tissues by osmosis, causing swelling. Dialysis. Dialysis uses osmosis and diffusion to remove waste and excess water from the blood. So a tip here to remember is that water follows salt. When you think of osmosis, remember, water moves toward where there's more salt or solute. Osmosis is a passive movement just across those semi-permeable membranes, and just always remember it goes from low solute concentration to high solute concentration. So some clinical examples are IV fluids. Isotonic solution, which is 0.9, usually normal saline. This has the same osmolarity as plasma, so there's no net water movement. It only expands the extracellular fluid. So 0.9 normal saline, it's at the same level as the human body, so this is mainly for hydration, fluid resuscitation, or basically to reverse dehydration. Hypotonic solutions, such as 0.45 normal saline, which is hypotonic or less than 0.9. This lower solute concentration, it's lower than, the lower solute concentration is lower than plasma. The water moves into cells and the cells swell. So an example is you treat intracellular dehydration like diabetic ketoacidosis with caution. Hypertonic solution, such as a 3% saline, which is more or higher than 0.9. The higher solute concentration is where the water moves out of the cells and the cells shrink. So an example of this is that you reduce cerebral edema by pulling water out of brain cells. So red blood cells in different solutions. There's hypotonic fluid, which is where the red blood cells swell and may burst for hemolysis. Hypertonic fluid, which is where RBCs shrink, crenation. And then there's isotonic fluid, where the RBCs stay normal. Clinical condition, edema. Osmosis plays a role in third spacing and edema. For example, low albumin or hypoalbuminemia produces plasma oncotic pressure. The water leaks into interstitial tissues, and then there's swelling, as in liver cirrhosis or nephrotic syndrome. Dialysis. Osmosis and diffusion work together in this process. In hemodialysis, waste products and excess water move across a semi-permeable membrane to balance solute concentrations between blood and dialysate. Now, for this next part, we're going to actually move into a few questions. We have about 25 questions here. We're just going to go ahead through some multiple choice questions and review what you learned so far. First question here, which statement best defines osmosis? A movement of solutes from high to low concentration, a movement of water from low to high solute concentration, active transport of electrolytes, or movement of gases across a membrane. Let's think about that for a moment. And then our answer, B. Water moves across a semi-permeable membrane toward a higher solute concentration to balance concentrations. So this is a passive process and it's vital for fluid balance in cells. Next question. Which membrane property allows osmosis to occur? Impermeable membrane, semi-permeable membrane, fully permeable to solutes, or none of the above? The correct answer, B. Osmosis depends on a semi-permeable membrane that permits water to pass but restricts larger solute particles. So only water can pass through. Next question. What happens to a cell in a hypertonic solution? A. It swells and bursts. B. It shrinks. C. No change occurs. D. It divides. Okay, thinking about it, and the correct answer here, B. A hypertonic solution has more solutes than the cell's interior, so water leaves the cell, causing it to shrink. And that's for the hypertonic solution. Cells shrink. Next question. Which IV fluid is isotonic? D5W, 0.9 normal saline, 0.45 normal saline, 3% saline. The correct answer here is normal saline, 0.9. That matches the osmolarity of plasma and it causes no fluid shift into or out of cells. Next question. What is the danger of giving pure water IV? The cells shrink, the cells burst, it causes dehydration, or it increases sodium levels. The correct answer, B. Pure water makes plasma hypotonic, leading to rapid water movement into cells and potential cell rupture. Next question. Which solution helps reduce cerebral edema? Isotonic, hypotonic, hypertonic, or pure water? The correct answer here is C, hypertonic. Those solutions draw water out of swollen brain cells, decreasing intracranial pressure. Which patient is most at risk for third spacing due to osmosis? A patient with high albumin, a patient with hypoalbuminemia, a patient with dehydration, or a patient on diuretics? The answer here, B. Low plasma proteins lower oncotic pressure, causing fluid to leak into tissues and body cavities. Next question. Dialysis removes fluid by using diffusion only, filtration only, osmosis and diffusion, or active transport? C. Dialysis relies on osmosis to pull excess water out and diffusion to remove waste products. Next question. Which is an example of osmosis in the body? Oxygen exchange in lungs, sodium-potassium pump, water absorption in intestines, or glucose breakdown? C. Water moves by osmosis in the intestines to balance solute levels and support nutrient absorption. Next question. A hypotonic IV fluid should be used cautiously to prevent cell dehydration, cell shrinkage, excessive cell swelling, or hypernatremia. The correct answer here, C. Hypotonic fluids can cause excessive water entry into cells, leading to swelling and rupture. Next question. The primary force behind osmosis is blood pressure, ATP, concentration gradient, or enzymes? The answer is C. Osmosis occurs due to the natural tendency of water to move from an area of low solute to high solute concentration. Next question. Which fluid has the same osmolarity as plasma? 3% saline, D5W, 0.9 normal saline, or 0.45 normal saline? The answer here, C. 0.9 normal saline is isotonic, so it does not cause fluid shifts, and it is the same osmolarity. Next question. A patient has pitting edema due to low albumin. The nurse explains that this is caused by A. Hydrostatic pressure, B. Increased osmotic pressure, C. Low oncotic pressure, or D. Low hydrostatic pressure. The correct answer, C. Less albumin means less osmotic pull to keep fluid in vessels, so the fluid leaks out into the tissues. Next question. In hemodialysis, fluid removal works because solutes push water through the dialyzer, water moves to balance solute concentrations, pump forces water out of blood, blood pressure pushes water out. The correct answer here, B. The dialysate has a higher solute concentration than the blood, so water moves out to equalize levels. Next question. What is the effect of hypertonic IV fluid on red blood cells? RBCs swell and burst, RBCs shrink, RBCs divide, RBCs remain unchanged. The correct answer here, B. Hypertonic solutions cause water to leave the cells, shrinking them. Which patient needs a hypertonic solution? A patient with dehydration, a patient with cerebral edema, a patient with ketoacidosis, a patient with low sodium? The correct answer, B. Hypertonic solutions pull water from brain cells to lower pressure. Next question. What does water follows salt mean for osmosis? Salt moves with water. Water dilutes high solute areas. Salt controls active transport. Water and salt move together equally. The correct answer, B. Water naturally shifts toward areas with higher solute to maintain balance. Next question. Which condition may worsen with hypotonic fluids? Edema, hypernatremia, dehydration, low blood pressure? The correct answer here is A. Hypotonic fluids push water into tissues, worsening fluid accumulation. Next question. A nurse uses which principle to prevent fluid overload? Using pure water IV, using isotonic IVs for dehydration, using hypotonic IVs routinely, or ignoring fluid status. The correct answer here, B. Isotonic fluids expand blood volume without causing water shifts into cells. Next question. When giving diuretics, the nurse monitors osmosis only, diffusion only, fluid and electrolyte balance, none of the above. The correct answer here is C. Diuretics affect fluid balance by increasing urine output. Nurses monitor electrolytes. Next question. How does osmosis affect ascites in liver disease? It increases plasma proteins. It causes fluid to leave vessels. It stops fluid shifts, or it prevents edema. The correct answer here, B. Low albumin in liver disease decreases oncotic pressure, so fluid moves into the abdominal cavity. Next question. Why is osmosis so important in treating burns? It prevents dehydration, it controls infection, it replaces protein loss, it balances fluid shifts. The correct answer, D. Severe burns disrupt fluid balance, so managing osmosis helps prevent massive fluid loss into tissues. Next question. Which disease commonly involves pulmonary edema due to osmosis? Diabetes mellitus, congestive heart failure, anemia, or asthma? The correct answer here, B. In heart failure, increased hydrostatic pressure pushes fluid into lung tissues, and osmosis draws water into alveoli. Next question. Which disorder can cause cerebral edema by affecting osmosis? Hypernatremia, hyponatremia, hypoglycemia, or hypercalcemia? The correct answer here, B. Low sodium causes water to shift into brain cells, leading to swelling. Next question. How does osmosis contribute to dehydration in diabetes insipidus? It retains water in blood. It causes water to follow glucose. It increases water loss in urine. It prevents urination. The correct answer here is C. Large amounts of dilute urine are lost because water does not stay in the blood without antidiuretic hormone, leading to dehydration due to osmotic imbalance. So, if this practice session helped you out, do me a huge favor and hit that like button and subscribe to the channel. We're going to be releasing more of these mock exams covering all sorts of topics, med-surg, peds, pharm, you name it. The more you practice with these kind of questions, the more natural it will feel on exam day. Drop a comment below, let me know what topics you'd like to review next, and we'll see you in the next video.